melasma seems like hormones for sure. I know that
Right.
I have hypothyroidism,
Mhm.
so I know that that can sometimes make it worse
Mhm.
too. Why is it that melasma is so like hard to understand versus like, I feel like I've taken my mom in to get like laser treatments, right? And I'm like, she's got melasma because I'm just assuming she's like me
Right.
with melasma. And they're like, no, these are sunspots. And I'm like, well, what's the difference? Like,
Right.
why is it that I'm getting melasma and she's getting sunspots?
So melasma is something that we see usually in the 30s, 40s, or even in the 20s if someone has a baby, right?
Yep.
It's heavily driven by hormones. They used to call it the mask of pregnancy. And you would get like basically these two little patches on your cheek, sometimes on the upper lip and then sometimes on the center of the forehead. So definitely with pregnancy and these changes in hormones, we see this mask, right? The mask of pregnancy. A lot of women, it goes away when they have their baby, but a lot of women, it persists. And patients will tell me, I developed this after I had my first child or my second child. So melasma is a little bit complicated. Like I mentioned, it's not the easiest type of hyperpigmentation to treat. I feel like the pigment of melasma wants to be there. It's like it's set up its house, and you're the battle when we're treating melasma is trying to kick it out of its house. But the second that you kind of give it a little break, it like resets up, starts nesting, and wants to be in its house. So that's the difference with melasma, is that pigment has a drive to want to be there. Whereas with a sunspot, like you were mentioning with your mom, we can use lasers in the right patient, not in all patients, but in the right patient. And when you superficially remove that sunspot with a laser or some sort of device, it kind of gives up. It's not going to repopulate. It's gone. Whereas melasma, I feel like the melanocytes or the pigment of melasma sets up its house.
Like it's deep in there,
it
right?
wants to be there.
Yeah.
And so it's a little bit of a battle to kind of kick it out. But that's the main difference, is that there's a constant drive to repigment even after it's cleared.